Hi, good morning Carlos. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 8th of July 2021. How are you doing?
Hi, good morning Mihiraa. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Carlos Stokes.
And what is your candidate number, please?
My candidate number is 234791120.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Do you believe that nursing is a rewarding profession?
My profession's primary objective is to see folks improve, recover, and also return to their homes safely. I love helping people and offering them the necessary treatment, plus emotional support each day. I feel happy to find that I am influencing the life of somebody else in a positive manner, and this makes my days meaningful and fruitful.
What are your strengths?
I think that my most significant strengths are my passion for assisting individuals, patience, compassion, as well as careful attention to detail. I also have remarkable people skills. I can speak with the patients, take notes of their fears and apprehensions, and provide emotional support whenever required. I make it a point to make them understand that they are not alone. I can manage my job pretty well, since I prefer staying organized, according to my schedule.
What are your weaknesses?
One of my most significant weaknesses is that I tend to become nervous when I cannot accomplish a particular task that I am supposed to do. At times, I become somewhat harsh on myself, in case I do not succeed. It makes me stress in the long run. However, I am attempting to work on this particular thing.
How will you be able to manage a crisis?
In the event of a crisis, I will make an attempt to comprehend the situation and figure out whether it is something that I can handle, or if it requires the help of senior management. In case it falls under my jurisdiction, I will assess the available resources and create an action plan for dealing with the situation effectively. I will make an attempt to tackle the situation by taking the assistance of my coworkers and informing the issue to the proper person.
How would you like to tackle a patient who is not complacent with your care?
In case the patient or his relatives are not absolutely satisfied with the care provided by me, I would be trying to comprehend their complaints and frustrations. Moreover, I would try to do everything to fix the problem. If required, I will take the assistance of senior management to deliver the goods.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Good morning. My name is Carlos Stokes, one of the nurses working in this clinic. How may I help you today?
Good morning, nurse. I am here for my son. He is having acne, and I would like to know how it can be treated.
I appreciate your willingness to seek medical advice. Well, how may I address you?
Thank you for your words. My name is Mihiraa.
Mihiraa, is your son with you?
No.
In the case of acne, we require to assess him for providing better treatment. It is because acne signs vary depending on the severity of the condition.
It's okay. I understand that, but you can provide me with the basic details about acne, as I am not really aware of the condition.
Sure, I can provide the basic details for your understanding. For providing sufficient details, may I know your son's name and age, please?
Yes, his name is Charles, and he is 15 years old.
Thank you for your information. Charles is a 15-year-old boy who is going through the biological transitional phase. Acne is most common among teenagers, though it affects people of all ages.
Okay.
In this age group, hormonal changes happen. Androgens are hormones that increase in boys and girls during puberty and can cause acne.
What are the most common treatment options available for him?
Mihiraa, the treatment regimen that the doctor recommends depends on your son's age, the type and severity of his acne, and what he is willing to commit to. For example, he may need to wash and apply medications to the affected skin twice a day for several weeks. Topical medications and oral medications are often used in combination.
All right, I understand what you mean. But there are several over-the-counter medications, isn't it?
Your question is reasonable, Mihiraa. For acne, there are several over-the-counter medications available. Most teenagers will be trying them first. While over-the-counter acne treatment solutions can control the acne of some people, they fall short of many others. If your son has tried over-the-counter acne products for 4 to 6 weeks, and they haven't helped, he needs to consult the doctor for prescription-strength medications. A dermatologist can help your son to control his acne, avoid scarring or other damage to his skin, and also to make his scars less noticeable. By the way, Mihiraa, has he tried any remedies for acne?
Well, I actually do not allow him to try anything as of now. What I advise him is to wash his face at regular intervals, to clear off the dirt and get rid of oily skin.
I appreciate your consciousness. But Mihiraa, acne isn't caused by dirty skin. In fact, scrubbing the skin too hard, or cleansing it with harsh soaps or chemicals, irritates the skin and can make acne worse.
Oh, is it?
Yes, I understand how careful you are with your child's health. I strongly recommend you make a consultation for your son with a dermatologist for better treatment.
What you have said is correct, but you know, nurse, he is going to have his exams soon, and I don't want to disturb him with his treatments.
I acknowledge your concerns. Mihiraa, acne can be painful, both emotionally and physically. If left untreated, it can even become an affront to the well-being and self-esteem of your son, as he suffers through it. Delaying treatment can result in acne scars that cannot be removed without cosmetic treatments.
Oh, I see.
Yes, Mihiraa. Fortunately, even in the case of severe acne, these scars can be prevented by treating the site of breakouts quickly and efficiently. An experienced dermatologist can help stop the breakouts as quickly as possible, and thus lower the chance of receiving these enduring reminders in the battle with acne.
Yes, nurse. I understand that.
Moreover, dermatologists are experts at identifying and treating a wide variety of skin conditions. Seeking out the help of one to treat your son's acne can benefit him in a number of ways. Talk with the doctor about the risks and benefits of medications and other treatments he might be considering. And make follow-up appointments with the doctor every 3 to 6 months until his skin improves.
Okay, nurse.
Mihiraa, it takes hardly several minutes to get consulted. By that, your son's studies will not be affected. In addition, he might feel more confident and relaxed after seeing the specialist. Can I book an appointment with the dermatologist for him?
All right, nurse. You may please.
Thank you for your understanding and acceptance. I have booked the appointment for your son.
Thank you.
No mention, please. Mihiraa, always feel free to contact us with any questions. I wish him a speedy recovery.
Sure. Thank you. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.